Dr. Thomas King is a foot and ankle specialist with UKHealthCare Orthopedic Surgery and Sports Medicine. He and our other specialists provide care for a variety of conditions, including pain, injuries, plantar fasciitis, and diabetes-related foot conditions. We sat down with Dr. King to discuss common conditions he treats and his tips to help you know when it's time to see a medical professional.
What are the most common things that you see in clinic?
So most commonly we see plantar fasciitis, or just heel pain for most people. We see problems with the Achilles tendon, ankle sprains, and foot deformities.
Let's talk about plantar fasciitis a little bit. If someone has this, what can they do to manage their pain at home?
The best thing to do is to kind of evaluate footwear. So if we are in poorly supportive or no support shoes or barefoot walking most of the time, we want to change that. So a good supportive sandal at home or a house slipper may be augmented with a shoe insert. At that point, there are some stretches that can be done. Basically, typical calf stretches, kind of like the same stretches your teacher would have you do in gym class years ago. There are even specific stretching devices available online that you can find that are made for plantar fasciitis. Frozen water bottle, rolling that about 20 minutes a couple times a day. Basically, just a typical, disposable water bottle that you would buy at Kroger or the gas station. Fill it with water, leave a little room at the top, and toss it in the freezer. When you get home from work, take that out, go sit at your kitchen table or on the couch, and with a sock on, just roll your heel kind of all the way from the heel area, kind of all the way out towards the arch and the ball of the foot, and just back and forth. You can put as much pressure on it as tolerated. When you're finished, give it a good wash, throw it back in the freezer, you're ready for next time. And they sell night splints online that you can utilize. Most people are not able to tolerate sleeping in them, but if you wear them in the evening, if you're streaming your favorite show or reading a book or whatever you do with your leisure time, that can be helpful to stretch it out. If you've done a couple of weeks of that, or say 4 weeks of that, and you're not seeing improvement, symptoms are worsening, probably time to consider going in and get checked out.
Thanks to Dr. Thomas King for joining us to talk about foot and ankle health and how our experts at UKHealthCare Orthopedic Surgery and Sports Medicine can help. To learn more or to schedule an appointment, visit ukhealthcare.com/ortho.